Dr. Nick Van Terheyden. It's a pleasure to have you here.
I'm glad you say that because I really want to own that trademark. So it's the Dr. Nick and the Dr. Nick, the incrementalist and whiskey librarian.
And as far as I'm concerned, they're all yours. You own them all. I have ceded any control I had over any of those that have absolutely no relationship to me, other than I do like the, what was the last one you had?
The whiskey librarian?
The whiskey librarian. Good whiskey is always good.
I'm just going to say that I shared a little bit of that over the weekend with some of your compatriots, and I think they had a good time.
I think you introduced them to some new flavors.
I certainly did.
So that's fantastic, and you clearly have taught me a few too. I'm a good single malt lover, so it's nice to have you.
You have to come round.
Absolutely, absolutely.
That's what they learned.
So it's great to have you here, and tell us a little bit what you think about the conference so far.
So I think one of the most striking things to me is that I walked around the show floor, and there's this extraordinary number of startup companies. In fact, I took a sort of slow-mo video to give people a sense of how many companies keep emerging and trying to muscle their way into this healthcare space. That's good news because it means people are interested. It's good news because it's external thinkers and people that don't have the same baggage that we all have from living and breathing this healthcare system. And it's exciting because I think it will bring new ideas, new concepts, and I think some of the ways that we practice medicine and the things that we do, we can't even imagine what's going to change 2 years from now with all of that insight and innovation that's coming into this space.
So did you see any of them that you found interesting?
I've got to be honest, I didn't have enough time to jump in and spend a little bit of time with each of them. I saw 3 or 4 telehealth providers, which is a good indication of the value proposition if there's that many companies. I saw a company that was very intriguing to me, Epigenetics. Mm-hmm. One of the things that we know is that we are not a product of our genes. I think people are terrified of this concept of genetics and, this is my profile, therefore this is what I will be. We already know today, if I sequenced you now, today, or in fact at birth, I could extend your life and the quality of your life by a minimum of 8 years based on the science that we have today. So the idea that we can start to bring epigenetics into healthcare.
So give me some examples of that.
How to extend your life?
Yeah, based on my genetics.
More single malt whiskey, clearly.
Okay. And it will be a good life, too.
and I would say it would be an incremental amount. But just
incremental. So how much do I get for the whiskey? That's what I want to know. How much more life do I get?
How many life life points?
Quality life years. What is the quality? Yeah.
So the interesting thing about alcohol, and to be clear, I'm not advocating alcohol
Correct.
or advice not to be deemed medical, the usual disclaimers. But the interesting thing about alcohol is that a small amount on a regular basis actually improves our life expectancy. I can't give you a precise number because obviously that varies by individual. We're not even sure why. Some of it may just simply be that it's helping with the relaxation, stress relief,
drop stress,
all of those things.
Maybe you get some of those stress hormones dropped out.
And absolutely, I know. I certainly
feel that. The cardiac
feel
disease risk associated with increased stress.
We've known for a long time that red wine has an associated element of cardioprotectiveness that we think is associated with resveratrol. That's the compound that maybe it is. But interestingly, if I give you resveratrol, we don't get the same effect. Good news if you like wine, just to be clear. But it's simple things like that.
And what are some of the other examples that would maybe be non-alcohol related about you've run my genome, hey Fred, do a couple of different things, this will make you live a little longer?
So, let's think of specific examples around some of the insights that are a little bit more advanced than, gosh, you need more exercise, or you should reduce your calorie intake, or, all of those things I think we know, and generically they give us some insights. I think one of the most intriguing things that I've started to see is the potential to gain insight into the gut biome. So historically, what do we know about the gut biome? Well, there was a bunch of bacteria that were in there, 20 or so, and they were contributing to digestion. Now we're starting to sequence it. We can see variations in the biome based on the sequencing that's both very low cost and it's very fast. So what does that offer us? It means that I can now look at your biome and say, well, gosh, Fred, in your particular instance, your diet isn't the same as mine. Radical thoughts. So, it's no longer the pyramid that everybody says, and the pyramid's changed. The idea that, high fat, low carb, or whatever the particular fat is that we're dealing with today is appropriate for the whole population. Quite frankly, in the perspective of what we know today, is preposterous. It's completely mad. So now we can start to customize that based on what your biome already has, and we can customize your biome to change the way that you're digesting food and reacting to it. So some examples of that, I've noticed in my own family that we as individuals react differently to different diets. So we've gone on a variety of sort of exercises and journeys with full vegan for the whole family. Worked for some of the family, didn't work so well for others. And it turns out that, excluding dairy in particular instances was very beneficial for some, not for others. I have Dutch genes. The Dutch have been consuming dairy for centuries. It's a core component.
Ja,
absolutely. Vlaar. Gosh, we Nederlands spreken nu?
Ik kan een klein beetje Nederlands spreken. Ja, ik heb in Voorburg gewoond in 1994.
Oh, helemaal.
Dankjewel.
So, for me, didn't work. So I think that customization, which some of it is influenced by the history that contributed to that, is going to change the way that we start to give advice. That's really exciting.
So this is really kind of the population health precision medicine merger to get to an N of 1 of your assessment, to risk stratify you and then tell you here's exactly what we need to, or you need to do to improve your health.
And isn't that what we all want?
Absolutely.
Because the other thing that I think that gives, just based on a limited amount of experience, is if you refine the advice down to the individual, guess what? Not only is that advice better in terms of outcomes, but it's actually more palatable and it tends to be more successful because you like it.
Great point.
So it's going to get you far further down the track of extended high-quality life. That's really exciting.
Yeah, it is. So I'm going to steer you a little different here, Nick. I watch your comments on LinkedIn, Twitter. You are sort of, and I'll say this in all due respect, and I like this, it's a way I like to think of how to do it. You're sort of a Renaissance guy. You're looking at space stuff and astronomy and whiskey and all these other areas. And I would assume you can take some things you see from there and say, how does that fit in healthcare? Is that true?
Yeah, so that's absolutely right. And I one of the things that I've heard from certainly purist marketing folks is I'm too diluted, too scattered.
I get that same thing.
And I respect that. I mean, I think it's hard to sort of focus, and it's hard. Sometimes it's hard to put me in a box, and we all like to do that. Not in a negative way, but we like to categorize people based on characteristics, and in some respects that's hard for me. It's easy on one, a single dimension. I'm a physician, great, so got that, but then beyond that it extends much further. And whilst I respect that, one of the value propositions and some of the real innovation and what I've seen in incremental improvements is when you bring together these disparate kind of thought processes and thinking. You see this in some of the innovation hubs. I saw it at Carnegie Mellon. I interviewed some folks, and they'd come up with this astoundingly, I want to say simple, I don't want to diminish it, idea.
Yeah.
Why not take liver cells, inject them into the body, and have your body create its own liver? It does that actually in the lymphocyte system. It sounds simple at this point, but the insight of that came from the merger of two different people that had different scientific backgrounds and research. And we've now got the potential to produce organs by simply injecting cells into people. And guess what? There's no rejection phenomenon associated with that because they're your liver cells, you know. So imagine that for other cell systems. So bringing together all of that insight, I think, delivers this incredible opportunity. And what I've discovered, and one of the reasons, you know, so partly I'm selfish. I'm just fascinated by all this stuff. I love space, love, you know, the concept of us in this universe is just mind-blowing to me. I love malt whiskey, so hell, I'll throw that in just for fun. But bringing all of that in allows me to sort of come up with insights that ordinarily I might not have done. And what I hope to do is to stimulate that in others by exposing them.
Yes.
I think if we're too narrow, we limit both our human potential and the potential for society.
And at the same time, as you look at these grand things like space and some of the other areas, you know, I'm interested in CRISPR and these other things, you talk about, yeah, it's great to think that big baby down the road, but it's all about little incremental changes.
Yeah, so I'm a big fan of the incremental improvement. You know, occasionally I get into spats with folks online, you know, respectfully, but, you know, no, we want the moonshot, we want this, we want that. I think we all want the moonshot. But the reality is that in almost all the instances, that eureka moment that we always reference back to didn't actually happen as a eureka moment. If you go and analyze the Uber and the Airbnb, it wasn't this point at which these three guys got together over Scottish malt whiskey and came up with a concept of, hey, we should change the taxi system or the transportation system. It was a series of small little incremental changes that add up to that. And that's my premise. And the only difference between the moonshot or this exponential is a time factor. So if you do those incremental improvements on a rapid speed cycle, you get to this exponential change, you do so faster, and you do so at less risk with incremental improvements.
Right, and I look at it from the point of view that to bring a group together, or to say to create this mission, kind of like Kennedy did, we want to get there, so you put that out there as the vision, and you build those pieces in, recognizing we ain't going to go here to there, so what are those little things we need to do, especially on these grander things. And in healthcare, I think it's important. We've got a major problems we need to fix, whether it's the diabetes issue, it's the opioid issue, and in essence, if you can say, we're going to wrap our team around getting there, and now how do we do that step by step by step, I think is a good way to bring the two together.
You know, of course, I love that analogy because probably like you, I grew up on that space program. You know, the reach, you know, what that drove, the innovation that it created. But that's exactly right. It was these small things that, you know, in hindsight we look back on, and Velcro and Tang and, you know, the things that everybody knows about, you know, good Lord, none of that would have happened. Well, I'm sure it would at some point, but not in the same sort of rapidity. And that was an astounding achievement in 10 years. It was sub 10 years, right? And I think that goal setting, the other thing that's key to that, and, you know, to deliver against that incremental improvement is you have to have a leader that leads, that doesn't drive. So they have to be out front showing people the direction and the vision, and I think that's what we saw in that particular president. He was capable of marshalling the resources, people got behind him, and you know, that's what we need in healthcare, is individuals that will lead that, set that big goal, but ultimately find those small steps and support it, and understand that they're not all going to be correct.
No, you're going to make mistakes on the way and go right, and then you got to come back left and iterate, as you said, over and over until you get there. And it's interesting because I was just in Mississippi, and my presentation you may have seen was SpaceX moonshots and diabetes in Mississippi. And what I talked about was a way to say, could we take a decade or two and seek to eradicate type 2 lifestyle-based diabetes in the state? How would you do that, and what pieces would you need to get there? And hopefully, as you said, you know, with President Kennedy, I asked this question: where is the Elon Musk of healthcare?
Right.
You know, who is the person that he said, I'm going to Mars, and his first mission was actually, I'm going to drop a greenhouse on Mars just to get people excited about space again. Just fascinating.
Absolutely. It's, you know, set that sort of far-reaching vision, and then enable people. And the thing about the small changes and the incremental improvements is it's low risk, because if you make a small change and it's incorrect,
That's a great point.
you've lost so much less in the sequencing of all of that. And that's important because we don't have the resources to waste, so we don't want to sort of extend that unnecessarily.
And I think the other point you brought up sort of in the closing here was, you look outside to all these other things. You brought in all these other thought areas. And if we're going to solve some of these big problems we have in healthcare, we need to bring in people outside of healthcare to help us think through some of those things. There may be some great answers from people out there to help us do this.
It's inevitable. And the thing about healthcare is it's personal. So if you get these folks involved, it's not that they come in with no knowledge. Sure, they have limited knowledge because their perspective typically is as a patient. But, you know, the value of that contribution without the baggage of, you know, existing clinical activity is an imperative in all of this. And everybody wants to get involved. We all want to fix it.
Yeah.
It's not as if people wake up in the morning saying, how can I fleece out healthcare? How can I break the system? You know, how can I deliver awful care? That's not the case.
Yeah,
I don't buy it. I buy that people come out with the best possible intentions. Yeah. And if they don't deliver against that, the system has failed them, and we have to fix the system and enable them to deliver better solutions.